So good afternoon, Paulette. I understand that your mentor asked you to speak with me because you had a difficult time passing step 3. Can you tell me why you think you might have had trouble?
Well, I'm not sure exactly. I did fine on step 2 and step 1, meaning that I pass about average scores. I'm not really the best taking tests. I did a lot of questions for step 3, so I'm not sure what did I do wrong.
Okay. Well, I hope after this session we'll be able to give you some pointers for test taking and study habits. So let me start by giving you this sample test question, and I'd like you to go through it exactly as if you were taking an exam. The only difference being I want you to think aloud as you go through it. So if you normally read word for word, just read word for word. If you normally skim, just read what you're skimming. And any interior thoughts or commentary that come to your mind, just speak them out loud so that I can hear what you're thinking, okay?
Okay, sounds good. Okay, I think I get it. So we have a 73-year-old woman with a past medical history of diabetes mellitus type 2, hypertension, and knee osteoarthritis. She presented to the outpatient clinic for evaluation of feeling extremely cold and cough. For the previous 2 days, she has had feeling weak with a non-productive cough. On the morning presentation, she awoke feeling very cold. A now productive cough with white sputum, and right-sided chest pain with coughing. She denied any fevers, rigors, limb swelling, changes in her bowel habits, or urinary symptoms. So let me see. So this is sounds like an acute infection, possibly pneumonia versus viral URI. No fever, though she seems chilled. Let's see, her medications include metformin, like Sinopril, acetaminophen, and she does not drink alcohol or smoke. She lives with daughter. A physical exam, she's wearing 2 coats, alert and oriented, no acute distress, vital signs, heart rate of 75, blood pressure 130/84, respiratory rate 14. Temperature 99.0, oxygen saturation 98 at room air. So vitals are stable. She's not really febrile or tachypneic. On physical exam, so lung exam is significant for bronchial breath sounds in the right base, which I think that fits with pneumonia. Her cardiovascular examination is unremarkable. Her CBC is significant for a white blood cell count of 12.3. Chemistry panel, it's normal, except for glucose of 116. Her chest X-ray shows a right lower low infiltrates without any effusion. So putting all together, all of this sounds like community-acquired pneumonia to me. So what is the next step in management for this patient? CT angiogram of the chest, inpatient treatment with ceftriaxone and azithromycin, inpatient treatment with imipenem, outpatient treatment with levofloxacin, outpatient treatment with amoxicillin. So to summarize, this patient has community-acquired pneumonia, mild in nature by Curve 65. So I think I will go with outpatient treatment, though I'm not really sure if answer is D or E. Let me see. I guess I'll go with E, outpatient with amoxicillin.
Okay, is that your final answer?
I think so.
Okay.
Yes.
All right, so the correct answer is actually D, outpatient treatment with levofloxacin. Do you have any ideas why levofloxacin might be the right answer instead of amoxicillin?
Let me think. It might have something to do with the spectrum of activity, although I'm not really very good at bugs and the antibiotics.
Well, you're right. It definitely has to do with the spectrum of activity for the antibiotics and the bugs involved in community-acquired pneumonia, which understandably, all those things can be difficult to remember. But knowing that answering this question correctly requires knowledge of the antibiotics and the organisms involved in community-acquired pneumonia, what is your plan to improve?
Let me see. I guess I should read more about community-acquired pneumonia.
Well, that's not specific enough. So everyone needs to read more about everything that they see every day in clinic. But what do you need to do to get this question and similar questions about community-acquired pneumonia right in the future?
I'm not sure then.
Okay, well let me ask you this. How do you learn best? And by that I mean, thinking back to medical school, how did you study and retain material the best?
So when I was in med school, I used to write my own notes. Everything seemed more clear when I do my handwriting, so everything makes more sense to me. But I'm not really buying that right at this time because I don't really have much time.
I understand. It's time consuming to study that way, but we need to help you make time, and that's one of the reasons I pushed you to be more specific in your study plan, because your time is valuable and you want to make sure that you're using it on the specific things that you need to learn. So knowing that your knowledge deficit for this question revolved around causative organisms and antimicrobial spectra, you could make a table or a written chart, something in your own handwriting, organized in a way that makes sense to you, to help you remember the most common causative organisms and the antibiotics that are appropriate for empiric coverage to treat community-acquired pneumonia. Does that make sense to you?
Yeah, that sounds good.